As I'm about to introduce our next guest, I want to show everybody President-elect Joe Biden got his second inoculation today. I believe he got the Pfizer vaccine. This is round 2. Remember, Pfizer and Moderna are 2-shot vaccines. He and Vice President-elect Kamala Harris have gotten their first inoculations, and earlier today, the president-elect got this second dose. So he is good to go in a couple more days, and he will have the protection of that vaccine. But what about the rest of us? Rick Pollack is president and CEO of the American Hospital Association. He joins us now after sending a letter on behalf of the organization to Alex Azar, the Secretary of Health and Human Services. It is Dr. Fauci's claim that 75% of the population will be inoculated by the end of May. A lot of us want it now, but for reasons obvious, we can't get it. How likely is it that Fauci will be right, sir?
Well, we have to, in order to get herd immunity, first of all, thanks for having me. In order to get herd immunity by the end of the spring or early summer, we have to be at roughly 2 million vaccinations per day. We're not nearly at that point. So there is a real need to step up the pace and to bring more assets into this as soon as possible if we're going to try to hit those numbers.
Well, Rick, I think the question is then how do we do it? How do we pick up the pace? Do we need to start over? Do we need to change the way that we're approaching things?
Well, we certainly need to change the way we're approaching things. And in your lead-in, you mentioned the fact that we need to have stronger federal leadership. Something of this magnitude that's so large and complex is always going to have some bumps in the road. And you've got to give credit to the government for having gotten the vaccines produced, but you can't just leave it at the loading dock of the states and then expect that it will translate into shots in arms. We at hospitals and health systems are doing our very best, working as hard as we can to get those vaccines into arms. And we're operating with 50 different playbooks, actually 64 different playbooks. And we're going through and as quickly as possible. And we're adhering to the guidelines of each of these individual states in regard to the priority areas. But the other point here is we can't do it alone. We can't do it alone because we're also caring for the sick. And we're going to have more people engaged, more boots on the ground, more assets to help.
Rick, it's Angela here. I wonder if you could explain where the disconnect is on some of these expired vials and what's happening with them, because I think that there's, from the general person perspective, it would seem like they could be used. And I just wonder, I've heard stories as well about hospitals refusing to move to a lower tier in the priority group or just waiting until people show up. So I just wonder if you could, pan that out for us.
It's not us refusing to move to another priority group. It's abiding by what the states say we can do in terms of moving through that progression through the tiers. In fact, when you said people jumping the line, sometimes I think what you find happening is that there is a vaccine available and there is someone in a different tier, and we make it available to someone that may be in a different tier because we simply don't want to waste it. Every single drop is precious, and we need to make sure that we get it into many arms as possible. So we're just following the state guidelines here. And in many cases, we've asked the states to give the flexibility to go from one priority area to the next.
Rick, there was an article in the New York Times a couple of weeks ago about how this city back in the 1940s inoculated over 7 million people, I think they said, in a roughly 3-day period for smallpox. Now, I realize you don't have to refrigerate that at minus 70 degrees Celsius, minus 70 degrees Fahrenheit. But what I'm asking you is, are we going about this the wrong way? Shouldn't we be sending out your social security number says you're this old, this is when you're getting your vaccine, on this day, go here? Why aren't we doing it that way?
Again, we need to scale this up in a big way. And while our hospitals certainly are focused on healthcare workers on the front line, all of whom we owe a great debt of gratitude for their heroism, day in and day out, they're working so hard. And we're certainly situated to help out with first responders. We got to scale up. And that means involving the churches, involving stadiums, involving the schools. You know, there are 5,000 of us. There are 40,000 pharmacies that are out there. And we also have to scale up the people that can assist in making these injections. Again, we need more engagement, more assets, more people. And by the way, on the smallpox, you're right. Not only do you have the refrigeration issue, but in this case, you have the double dose issue.
Well, and also what you have right now is just going back to what you said earlier, it's just so hard for hospital staff to keep up with everything, because not only are they vaccinating people, but they're also facing, a lot of hospitals are at or close to capacity. Some are still facing PPE shortages. I'm curious what you're hearing from the hospitals that you represent. Are they still having problems getting their hands on PPE equipment? And also, what are they doing about possible staffing shortages at this point in the pandemic?
Yeah, no, it's a real problem. You know, some of the issues that existed before continue to exist. On PPE, we're much better than we were before, but there are sporadic problems that are out there. Many hospitals that are getting inundated now, there are about 10 states where ICU capacity is over 70%. They're faced with sporadic issues relative to PPE. On the manpower or person power front, we have real challenges there, and the expense of bringing in outside help continues to be a real challenge. So we are very stressed in this situation, particularly those hospitals that are undergoing spikes and surges, and they're in a lot of different parts across the country. So this continues to be a very challenging situation. And again, while we want to be strong partners in vaccination, we need the government to play a bigger role in scaling up because, again, we're focused on taking care of sick people as well.
Rick, I saw the letter, and to your point about the bigger role that government can play, what specifically can they do on the vaccines so that we're not seeing this mess of, you know, people jumping the line or not enough doses? Is there something specifically that the federal government can do?
More resources for our public health agencies, for sure. And I think we need to create a healthcare ready reserve. We need more people. You know, there are a lot of people that can be trained that are either unemployed or underemployed to do tracking, to do tracing, and to help in the vaccination process. Think of all of the veterans that are out there, many of which served in the armed forces as medics. They could be brought into this process. We need to be creative, we need to be innovative, and we need to find all of those approaches to basically scale up this effort if we're going to reach the numbers that we need to get to herd immunity by the summertime.
Rick Pollack is the president and CEO of the American Hospital Association. Thank you for joining us here on Yahoo Finance Live.